Alright, PC3 discussion 4. We've got a guy who's on the side, 48-year-old male who's on the side of a rest area, talking about excruciating pain in his back. He was driving to a vacation, and the pain suddenly come on. He's slightly overweight, other than high blood pressure and gout that she takes medication for. He's been in excellent health, so he's restless. He keeps asking for something for the pain. He says he's got blood in the urine, difficulty urinating, nauseous from the pain. Where he's hypertensive with 150 over 100. His pulse is a little fast at 105. There's nothing abnormal in the physical exam. Then they place him in the ambulance, IV at 100 milliliters an hour, and they transport him. So the question is, what is Mr. Clark's problem, and what led you to this conclusion? Well, I believe he's having a kidney stone because of the back pain. Lower flank pain is associated with kidney stones. There's blood in his urine, which is also a sign, and also the difficulty urinating. And the restlessness in walking around. Usually the pain associated with it can be alleviated somewhat by walking around, according to studies, and so that's kind of why he's walking around, I believe. And then, although it's not very common, the kidney stones can be formed from the uric acid, which is a product of gout, which is a buildup from gout. And so I believe he's having a kidney stone. What pre-hospital treatment is indicated for his condition? So we want to position him for comfort, try to get him comfortable. We need to be ready with a emesis bag for possible vomiting. Also an anti-anemic to hopefully maybe make him not feel like he's going to throw up. Pain management coaching might be appropriate to kind of help him breathe through the pain and help to focus on kind of just getting through it. And also an analgesic such as morphine or fentanyl for the pain to help him to get through it. There's also ketorolac, according to the book. I'm not familiar with it that much, but it's effective against renal colic, so it's effective also, especially if used with opiates. And then an IV for volume replacement and possibly any kind of drug administration. And then we're just going to position him for comfort and supportive care. How will this treatment help alleviate his problems? Well, the drugs will help him from vomiting. The positioning and coaching will help him to deal with the pain. The drugs will help him to deal with the pain. And then the fluids can help his body to begin to flush out the kidney stone if it's small enough to be flushed out. But the intention is not to obviously do that on scene or pre-hospital. We want him to get in and get a CAT scan or a scan so they can figure out how big it is. We're not going to try to shove some giant stone through his urethra. What will be Mr. Clark's hospital course, and what is his prognosis? Well, the morbidity and mortality of kidney stones is very low, unless there's some kind of hemorrhage that occurs or some kind of urinary tract blockage or obstruction. There's really no real concern of him dying. Of course, from what I understand, this is one of the more painful things that can happen to a human being. Obviously, at the hospital, they're going to do pain management. They're going to possibly do fluids to help move the stone to pass it, or if it's too large, they'll use shockwave lithotripsy. Which is sound waves, or which are waves to break up the larger stones into smaller ones so that they might be passable. If not, they can also surgically remove them if they have to. That's probably a last not a last ditch effort. Anyways, it's the last. That's the last step you'd want to take. So.